Most people miss the very first warning sign of cancer. They think it's just stress, or getting older, or nothing at all. But your body tries to warn you. And today, you're going to learn exactly what those warnings look like. By the end of this video, you'll know 10 early warning signs of cancer that doctors say you should never ignore. You'll understand why they happen, and you'll know when it's time to see a doctor. This information could save your life or someone you love. Here's why this matters. When cancer is caught early, survival rates can be as high as 99%. But when it's found late, treatment becomes much harder. The good news? Your body often gives you clues. You just need to know what to look for. Let's start with number 10. Sores that don't heal. If you have a sore that won't heal after 3 weeks, pay attention. This includes cuts that bleed, spots that crust over, or sores inside your mouth that refuse to go away. Normal cells repair damage. Cancer cells don't follow the rules. They grow and grow instead of healing. This can be an early sign of skin cancer or mouth cancer, especially in people who smoke or use tobacco. Imagine a man who notices a small spot on his cheek that bleeds every time he shaves. He figures it's just from the razor, but after a month, it's still there, crusting over, bleeding again. That's when he finally sees a doctor. Catching it early made treatment much simpler. Up next, number 9. Changes in bowel or bladder habits. Diarrhea that lasts for days, constipation that won't go away, feeling like you need to go, but nothing happens, or going way more often than normal. Your digestive system is like a highway. When something blocks the road, traffic slows down or takes weird detours. These changes can point to colorectal cancer, prostate cancer, or bladder cancer. Here's the surprising part. Colorectal cancer in younger adults has doubled since 1995, and younger people often wait longer to see a doctor because they think they're too young. Imagine someone in their 30s who keeps having stomach pain and diarrhea for weeks. They assume it's stress from work, but after a few months, they finally see a doctor and find out it's something more serious. The delay in getting checked made things harder to treat. If these changes last more than 4 weeks, get checked. Your body is trying to tell you something. Coming up at number 8. This one happens mostly at night. Persistent fever and night sweats. Night sweats so heavy, you have to change your clothes or sheets. Fevers above 100.4 that keep coming back even when you're not sick. Cancer cells can release chemicals that mess with your body's thermostat. Your immune system reacts by creating heat. It's like your body's alarm system going off, trying to warn you something's wrong. These symptoms are common in lymphoma and leukemia. Doctors even call fever, night sweats, and weight loss the B symptoms. These sweats are different from menopause. They happen over and over, almost every night. Picture someone who keeps waking up soaking wet night after night. They buy a fan, they change their sheets, they think maybe their bedroom is too warm. But after 2 weeks of this, plus a fever that keeps coming back, they finally see a doctor. Their body was sending them a serious message. If you've had night sweats and fevers for more than 2 weeks, talk to your doctor. Number 7 is next, and this one sneaks up on most people. Number 7. Difficulty swallowing. At first, it feels like food is getting stuck. You take smaller bites. You eat slower. Over time, you might switch to softer foods without even realizing it. Your esophagus is like a water slide. When a tumor starts growing, it acts like a speed bump, slowing down everything you swallow. This is often linked to esophageal cancer, throat cancer, and cancers of the head and neck. Think about someone who used to love eating steak. Over a few months, they start ordering soup more often. Then they switch to smoothies. Their family asks why they're always eating soft foods, and that's when they realize they've been avoiding anything hard to swallow. They see a doctor and catch it before it progresses further. The earlier you get help, the better the outcome. Some damage can become permanent if you wait too long. Next up is number 6, and you can spot this one just by looking in the mirror. Number 6. Skin changes and moles. Doctors use the A, B, C, D, E rule to spot melanoma. A for asymmetry. One half doesn't match the other. B for border. The edges are ragged, blurred, or notched. C for color. The mole has different colors mixed together. D for diameter. It's bigger than a pencil eraser, about 6 millimeters. E for evolving. The mole is changing in size, shape, or color. Think of a normal mole like a chocolate chip cookie, round, even, and the same color all over. A dangerous mole is more like a cookie that got burned in spots, cracked on the edges, and came out lopsided. When melanoma is caught early, there's a 99% survival rate. When it spreads to other organs, scans, that drops to 35%. Here's something most people don't know. 70 to 80% of melanomas appear on skin that looked completely normal before. Melanoma can also show up under your nails, on your feet, inside your mouth, or even in your eyes. People of color are especially at risk in these hidden areas, places that don't get sun exposure. Picture someone who notices a dark spot under their toenail. They assume they stubbed their toe and forgot about it, but the spot doesn't go away. After a few months, it's getting bigger. That's when they learn it's melanoma. Catching it early made treatment much easier. Check your skin once a month. If a mole looks different from all the others, the ugly duckling, get it checked. We're halfway there. Number 5 is next, and this is something you can feel with your own hands. Number 5. Lumps, bumps, or swollen lymph nodes. A lump can appear anywhere: your breast, testicle, neck, armpit, or groin. Lymph nodes usually swell during an infection and then go back to normal. But if they stay swollen for more than a week or two, it's time to get checked. Your lymph nodes are like security checkpoints in your body. When you get sick, they trap the bad guys like viruses or bacteria and swell up while they fight. They're supposed to shrink back down when you're better, but if cancer gets trapped in them, they stay swollen. Most lumps are not cancer. They might be cysts filled with fluid or benign tumors, but you can't tell just by feeling them. You need a doctor to check. Here's something really unusual. Some testicular tumors make a hormone called HCG, the same hormone that shows up in pregnancy tests. This hormone can actually cause breast tissue to grow in men. So if a guy notices his chest is growing or feels tender, it could be a sign of testicular cancer. Imagine a young man who feels a small lump in his testicle while taking a shower. It doesn't hurt, so he figures it's no big deal. But his doctor tells him that painless lumps are actually the most important ones to check. When caught at stage 1, testicular cancer has a 99% survival rate. If you find a lump or a swollen lymph node that doesn't go away, see your doctor. Up next is number 4, and this is one of the clearest warning signs your body can give you. Unusual bleeding or discharge. Blood in your stool. Blood in your urine. Bleeding between periods. Bleeding after menopause. Coughing up blood. Nipple discharge. Think of your body like a system of pipes. When a tumor causes a crack, blood leaks where it shouldn't. A huge study in 2024 looked at millions of colorectal cancer cases in people under 50. The most common warning sign? Blood in the stool. For bladder cancer, blood in the urine is usually the very first sign you notice. It might turn your pee orange, pink, or dark red. Here's the tough part. About 20% of younger adults with colorectal cancer had one or more warning signs for 3 months to 2 years before they were diagnosed. People waited too long to see a doctor because they were embarrassed or thought they were too young for cancer. Imagine someone who notices a little blood when they go to the bathroom. They assume it's just hemorrhoids, but after a few weeks, it's still happening. They finally see a doctor and find out it's colorectal cancer. Having 3 or more warning signs increased their chance of having cancer by 6 times compared to having no signs. If you see blood anywhere it shouldn't be, even once, tell your doctor. It might go away and come back, especially with bladder cancer. Don't ignore it. Number 3 is coming, and most people blame this one on allergies or a cold. A persistent cough lasting 3 weeks or more. A cough that lasts more than 3 weeks is a warning sign. It might be dry, it might be wet, it might feel like constant throat clearing. A tumor in the airway irritates cough receptors. It's like having a pebble in your shoe you can't shake out. Your body keeps trying to cough it out, but it won't go away. This symptom is most strongly linked to lung cancer. About 57% of lung cancer patients have a cough when they're diagnosed. Here's what surprises people. A lung cancer cough doesn't have to be severe. It can be subtle and tickly, just annoying enough that you notice it. Most long-lasting coughs aren't cancer. Fewer than 2% of people with chronic coughs actually have lung cancer. But if you're a smoker, or if your cough changes or gets worse, you need to get it checked. Picture someone who's had a smoker's cough for years. They're used to it, but suddenly the cough sounds different. It's raspier. They're coughing up blood. That change is what matters. They see a doctor and catch lung cancer at an early stage. If your cough lasts more than 3 weeks, especially if you're also coughing up blood, losing weight, or having chest pain, get it checked. We're down to the final 2. Number 2 is next, and this one completely drains your energy. Persistent fatigue. This isn't normal tired. This is exhaustion that takes over your whole life. You sleep for hours and still wake up feeling drained. Rest doesn't help. Cancer cells are like greedy guests at a party. They eat all the food and don't leave any for anyone else. They use up your body's nutrients and energy to grow, so your normal cells don't get what they need. In blood cancers like leukemia, the cancer crowds your bone marrow so much that your body can't make enough red blood cells. Without enough red blood cells, your body doesn't get enough oxygen. That's what makes you feel so tired. This type of fatigue shows up most often with leukemia and lymphoma. About 50% of people with these blood cancers report severe fatigue, rating it 7 out of 10 or higher. A huge survey of lymphoma patients found that 72% experienced fatigue that seriously impacted their daily lives. 56% of leukemia patients say they had fatigue even before they were diagnosed, and the fatigue is often accompanied by other symptoms like pale skin, dizziness, trouble concentrating, or feeling breathless. Imagine someone who used to go for runs every morning. Over a few months, they can barely walk up the stairs. They sleep 9 hours a night but still need naps. They finally go to the doctor thinking they have anemia, and it turns out to be leukemia. The earlier they caught it, the better their treatment options. If your fatigue lasts more than 2 weeks and doesn't get better with rest, talk to your doctor, especially if you're also losing weight, feeling dizzy, or looking pale. And now, the #1 warning sign doctors say you should never ignore. Unexplained weight loss. Losing 10 pounds or 10% of your body weight in 6 months without trying is a major red flag. A groundbreaking study from January 2024 found that people who lost more than 10% of their body weight developed cancer at a rate of 1,362 cases per 100,000 people over 12 months. That's compared to only 869 cases in people who didn't lose weight. That's a huge difference. Here's why it happens. Cancer cells are like thieves. They steal nutrients and energy from your body to fuel their own growth. Your normal cells don't get the nutrition they need to stay healthy, so your body starts breaking down fat and muscle for energy. Your metabolism speeds up trying to keep up, but the cancer keeps taking more and more. This symptom is especially common with cancers of the upper digestive tract, like esophageal, stomach, liver, pancreas, and bile duct cancers. It also shows up with lung cancer, colorectal cancer, lymphoma, ovarian cancer, and kidney cancer. About 40% of all cancer patients report unexplained weight loss when they're first diagnosed. For nearly half of them, it's the very first sign they notice that something is wrong. Here's the part people miss. The weight loss is often gradual. You might not notice it at first. You think your clothes are just getting looser. You step on the scale and think, that's weird. But over a few months, it adds up. Think about someone who's always been a steady weight. Suddenly, over 4 months, they drop 15 pounds. They're eating the same amount. They're not exercising more. Friends and family start asking if they're okay. That's when they realize this isn't normal, and they see a doctor. For men, the risk of cancer can be about 3 times higher in the first 3 months after unexplained weight loss. For women, it's nearly twice as high. If you're losing weight and you're not trying to, don't wait. Tell your doctor right away. This is one of the most important early warning signs your body can give you. You're not alone. Millions of people miss early symptoms simply because no one ever taught them what to look for. That's exactly why sharing information like this matters so much. So there you have it, the 10 early warning signs of cancer you should never ignore. Remember, having one of these signs doesn't mean you have cancer. Most of the time, there's another explanation. But your body is smart. It knows when something's wrong. And these symptoms are your body's way of asking for help. Early detection saves lives. When cancer is caught early, treatment is more effective and survival rates are much, much higher. If any of these symptoms last more than 2 or 3 weeks, talk to your doctor. Don't wait. Don't feel embarrassed. Your health matters. If this video helped you understand these warning signs better, please hit the subscribe button. Share this with someone you care about. Take care of yourself. You're worth it.